Hi guys, my name is Jessica and this is my flashcard presentation on hypothyroidism. So we're going to scroll down here. So the disease process. Hypothyroidism is the second most common endocrine disorder in the United States after diabetes and affects an estimated 4.6% of the world's population. There are multiple different types of hypothyroidism, such as primary or central hypothyroidism, congenital hypothyroidism, or secondary hypothyroidism. Secondary hypothyroidism is related to geographic areas and populations with adequate dietary iodine. The most common cause of hypothyroidism is Hashimoto's disease, an autoimmune disease in which the individual's immune system creates antibodies that permanently damage thyroid gland function. Davis and Filippi also noted that due to the gradual onset and mild symptomology, there may be a gap between diagnosis and treatment, as individuals may not realize their symptoms are due to a hormonal cause. The impact on functioning and health is substantial for those with long-term or severe untreated hypothyroidism and can lead to substantial healthcare costs and other economic impact. I'm going to scroll down here a little bit more. Pathophysiology. So the main gland that we focus on in hypothyroidism is the thyroid. The thyroid is a butterfly-shaped endocrine gland in the neck that secretes triiodothyronine, known as T3, and thyroxine, known as T4. These hormones affect metabolism and many other body functions, including those of the heart and vascular systems. When the gland does not produce enough thyroid hormone for the body's needs, hypothyroidism results. While Van Meter and Huber also note a harmonious relationship between the hypothalamic pituitary secretion of TSH and the two thyroid hormones, there could be a dysfunction at either gland, such as the hypothalamus or the pituitary gland, leading to low production of the hormones in the thyroid. While there are mild forms of hypothyroidism, the more severe forms of hypothyroidism are identified as Hashimoto thyroiditis, a destructive autoimmune disorder, myxedema, which is a severe hyperthyroidism in adults leading to myxedema coma, which is a life-threatening complication in undiagnosed or untreated elderly patients. And then cretinism, which is untreated congenital hypothyroidism that may be related to an iodine deficiency in pregnancy or maybe a developmental defect. Some risk factors are females. It says individuals born with ovaries and who have extended exposure to endogenous estrogen over their lifetime are the most likely to develop hypothyroidism. Increasing age is another risk factor, as new onset peaks between 30 and 50 years of age, and overall incidence increases with age. Individuals aged more than 65 years are at the greatest risk of having hypothyroidism. And there is also a genetic risk factor. Genetic history of hypothyroidism in a genetic relative is associated with an increased lifetime risk of hypothyroidism, suggesting a genetic component. There is also a personal history of autoimmune conditions such as type 1 diabetes and celiac disease is also associated with the development of hypothyroidism. The congenital risk is related to an iodine deficiency in pregnancy or developmental defect, as well as there's also a risk of either excessive iodine intake in Hashimoto's or a lack of iodine intake can lead to an endemic goiter, which is also a sign of hypothyroidism. Here are the major signs and symptoms: menstrual irregularities, fatigue, depression, inability to concentrate, and mild to moderate weight gain. There is also hair loss, dry skin, and constipation, which can also occur and are more indicative of thyroid failure. Van Meter and Hubert also noted that bradycardia and an enlarged heart are major signs and symptoms. And then an endemic goiter or an enlargement of the thyroid gland occurs in regions where there are low iodine levels in the soil and food. So this picture below is actually a picture of someone with a goiter. And that's just the swelling around the neck right there. Diagnostic testing for hypothyroidism. So the U.S. Preventative Services Task Force does not support screening asymptomatic non-pregnant individuals. The decision for testing should be made based on risk factors and symptoms. So a strong physical assessment initially would be a good starting point for diagnostic testing. And then diagnosis of thyroid disease is based on levels of TSH and free thyroxine. Hypothyroidism typically presents with a low free thyroxine level because the thyroid gland is no longer functioning properly, and an elevated TSH level as the body is responding to the low thyroxine levels. Central hyperthyroidism is often subtle in clinical presentation with a biochemical picture comprising decreased FT4 and inappropriate TSH concentration. There's some debate about this last statement right here. As obviously in one study, it said that there is it has been argued that the diagnosis of central hypothyroidism may be missed with the first-line TSH approach. But the diagnostic testing that is presented here is specifically what they would do, a serum level of your T3, T4, and TSH. So the picture below is just a picture of the thyroid system. So you can see the hypothalamus located up here in the brain, and then there's other hormones here, but we're going to focus on this TSH right here, the thyroid stimulating hormone, which the arrow down goes to the thyroid gland. The thyroid gland then produces these hormones, which are the T3 and T4, which produce an increased metabolism within the body, proper growth and development, and increased catecholamine effects. There's another picture that I put in here, which is the newborn screening. As I was doing research, it was stated somewhere that in almost all of the United States, it is mandatory for the newborn screening to screen for congenital hypothyroidism through a heel stick, except for one state who doesn't do it, and that is Utah. So this picture here just kind of shows what they would do to test for congenital hypothyroidism, along with a lot of other congenital tests. Basically, they puncture the heel, they get the blood, and then they put it along this piece of paper right here in multiple areas to test for different specific congenital defects or disorders. And then it just says that the blood drop must complete the circle fully, harvest only the card back. And then here are my references. Hope you guys enjoy.